It's Dr. Kenny Levine with Health Talk. I'm here with Dr. David Robinson. You know, before I forget, I'd like to let our viewers know how they can find you if they have a concern. Where's your office? Do you have a website? Do you have a phone number? That kind of thing.
Oh, I wish I had a website, but I don't.
Okay.
Our office is called Advanced General Surgery. We're at 983 University Drive next to the Coral Square Mall. The phone number is 954-227-2030.
Patients can call your office directly?
Absolutely.
Okay, good. You want to talk a little bit about your melanoma surgery?
Sure. One of the things that I started out doing when I was in the laboratory at UCLA was working with a man named Don Morton. He was effectively, and still is, I think, one of the deans of melanoma in the world. And at the time, he had this idea that the deeper melanomas should have the lymph nodes taken out. And so we were trying to figure out which node groups you'd take out if you had a melanoma near the belt line. Would you take out the ones in the groin or the armpit area, the axilla? And we did the first study of lymph shed, so to speak, in the world, and found out where the nodes would drain to, or where they were receiving drainage from. That eventually evolved in his hands into the sentinel node study, which is done a great deal today. At the same time, a fellow named Balch looked up all of the patients at MD Anderson in Alabama and discovered that people with less than 3/4 of a millimeter depth almost never had nodes involved, but the very first ones at 0.76 millimeters had involvement. And so those patients, I think, should have their nodes looked at by sentinel node study. And so at the time when we talk about what we're going to do, which is a wide excision of the primary site, we usually go ahead and have them injected for sentinel node studies if it's deeper than 0.76 millimeters, and take out those nodes. We have a little Geiger counter called a sentinel probe, and the gamma probe is used in the operating room, and it shows you where the greatest signal is from where the nodes picked up what's injected at the time of the operation.
So that's sort of a decision that's made at the time of the surgical procedure.
In a way, the pathologist can't really do a frozen section on lymph nodes and see melanoma because the cells are so small. So we get that information back a week later, but we do take them out at the time to see which ones might be at risk.
And that's based upon the Geiger counter?
Yeah.
Kind of thing.
The skin is the largest organ of the body. It serves many important functions, including protecting the body from infection and regulating body temperature and fluids. The skin is primarily composed of 3 layers. The epidermis is the outer layer of the skin and contains basal and squamous cells. Melanocytes are also found in the epidermis. These are cells that contain pigment, which allows the skin to tan and which also protect the deeper layers of the skin from the effects of UV sunlight exposure. The dermis, which lies below the epidermis, contains blood vessels, connective tissue, hair follicles, and sweat glands. The subcutaneous layer, which is the deepest layer of skin, contains fat cells and collagen. Skin cancer occurs when there is an uncontrollable growth of abnormal cells in a layer of the skin. There are 3 common forms of skin cancer that are distinguished by the types of cells affected. Basal cell carcinoma is the most common form of skin cancer. This type of skin cancer does not typically spread, but does require treatment. Basal cell carcinomas most often develop in the areas of the skin exposed to the sun. Squamous cell carcinomas develop in the middle layer of the epidermis. This type of cancer can spread and can be life-threatening if not treated appropriately. Abnormal growths of melanocytes, called malignant melanomas, are the most aggressive form of skin cancer. Melanomas can spread quickly to other parts of the body and to organs. This type of skin cancer can be fatal if not detected and treated early.
You know, Dr. Robinson, Dr. David Robinson, I want to thank you so much. This is a tremendous education for me, and I know it's a very delicate subject, and people who are oncologists and surgical oncologists have wonderful hearts and tremendous empathy for their patients, and thank you so much for being here.
It's a pleasure. Thank you.
Thank you. It's Dr. Kenny Levine with Health Talk. We'll see you again next week. Thank you.
When First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.